Healthcare emergencies or healthcare in general? Well, hold on tight, because today we're talking about healthcare in the Philippines. Hey everybody, a lot of people have been asking me to make a video about what healthcare costs are in the Philippines. And I can only do that from the perspective of an American. My wife and I lived for 8 years married together. Well, we've been married for 10 years, but we lived for in 8 years for Florida. And that's where I've had my surgeries, was in Florida. That's where my wife has had numerous, well, not numerous, but that's where she's had healthcare services provided to her at, and it was in Florida. So this is going to be from the perspective of an American who had health insurance in Florida and had access to hospitals there. And the first thing I would like to say is that healthcare in America is expensive. Not only is it expensive from an out-of-pocket perspective, it's expensive from a all-over perspective. Once I've come to the Philippines and we've had some emergencies, which I'm fixing to get into, we realize just how affordable healthcare is in the Philippines in comparison to what we're used to in the United States. I'm gonna get into that a little bit more. I've got a medical bill right here from the last emergency room visit that we had in the States. And the reason why I'm making this video is we recently had an emergency room visit here in Metro Manila. So today I'm coming to you from our home base in Las Piñas, and we're fixing to crack into 14 points about healthcare in the Philippines from an American's perspective. Point number 1, bring your medical records. Why should I bring my medical records, Matthew? Well, if you have an ongoing medical condition, which most of us individuals that are about my age or my wife's age, I'm not going to tell you how old we are, but I'm over 40, most of us tend to have, some of us have at least one medical condition that we're managing from time to time. But nobody knows when an emergency is going to come up. Now, for me, for example, if you go look at my YouTube channel, go look at some of the past videos, you'll see I posted a lot of videos about my back surgeries. I've had 2 of them. So whenever I moved to the Philippines, I brought all the medical records necessary to help a doctor in the event that I needed to have more work done on my back. I've got access to those records and I can get them to a doctor. Also, my wife who came here, she has less health issues than I do, but like everybody, she has some health concerns. She brought the necessary paperwork that she needed. So whenever she went to the doctor, she was able to show the doctor what how she had been treated in the past, the way those things have been managed. So it gives the doctors a heads up on treating you whenever you do have to go to the doctor here. So I would say advice, tip, point, however you want to call it, number 1, is bring your medical records with you, and it'll give you a big foot up whenever you have to go in and see the doctor. Point or tip number 2, bring your medications, at least a 90-day supply. Myself, I take 1 medication. My wife and I don't like to take very much medicine. So if you're going to move here from the United States, this is strictly from the perspective of an American. Make sure before you leave that you go to your doctor and say, look, I'm moving outside of the United States. I need at least a 90-day supply so that I will be able to have enough medication to carry me over until I can get the medication I need from a doctor. Because you have to get here, you got to have your medical records. That way you can establish care with a physician, and that way you'll have enough medicine to carry you over until that physician can write you a supply of the medication that you need. Well, Matthew, what happens if they don't have the medication there that I take? Well, that brings us to our very next point of interest. Hold on. Number 3, research the medications you take and see if they're available in the country you're moving to. If it's the Philippines, do that in advance before you leave. Why? Well, there's a lot of medications that you can't get in the Philippines. Most you can, but there's some that you can't. For example, the one medication that my wife took most regularly whenever we moved here, she found out it was not available. However, because she brought her medical records, and whenever she had those, she was able to establish care with the physician was able to provide a medication to my wife that was a bridge to her, to get her through, to help her make it into, to help her get by. It wasn't a perfect solution, but I will say that it wasn't a complete and total disaster, because we had a medical plan whenever we moved here. Make sure you have a plan for your health care whenever you move to the Philippines. So if you take medication regularly, research those meds to make sure they're available, especially if you're moving to the Philippines. Make sure they're available here before you move. Number 4, find a doctor in the field that you're going to need before you come here. Well, Matthew, how am I going to do that? Well, you know, we got a thing now called the internet, and on the internet there's a thing called Google. And before we left the United States of America, we did the research. And now my wife, who is from the Philippines, already had some care established with doctors. And those doctors are still practicing medicine here. And she was able to reestablish care with those doctors. Me, Mr. Matthew, I had never been here before, or at least to live. I had never been here this is my residence. And so I had to find a doctor with the specialty that I needed whenever I moved here. And that was not difficult to do, but in Metro Manila, there was not a lot of doctors that practice this specialty. And so I had to find one. And it did take a little bit, but we found the doctor within just a few weeks of being here, and everything's worked out really good. But we took the time to research that before we came here, and there are some specialties that are very, very, very difficult to find here, like endocrinology. Not a lot of endocrinologists here. And I may be wrong. If I'm wrong, comment below and let me know. I'm sure you won't hesitate to correct me if I'm wrong. But do your research, due diligence, to make sure you get the health care you need, find the doctor you need whenever you get here. Moving on. Number 5. Location, location, location. The location of the doctor dictates the price you're going to pay. What do you mean, Matthew? Well, right now I'm at my home base. We're here in Las Piñas, which is about 30 minutes south of Metro Manila. And the hospital on that thumbnail which you clicked is Asian Hospital here in Las Piñas. My wife recently went to see a doctor there. And whenever we went to see that doctor, she charged us somewhere between 5,000 and 8,000 pesos to go see to see the doctor and to have the procedure done. My wife recently, not long after that, had to go see a different physician at St. Luke's Hospital, which is a major private hospital in Metro Manila. Many consider it to be the best hospital in the country. Went to see a doctor practicing the very same type of medicine. My wife had the very same procedure there, and it was over 10,000 pesos. So about 30% more, maybe 40% more my wife paid in Metro Manila at St. Luke's Hospital versus what we paid here in Las Piñas at Asian Hospital. Both hospitals are great, but at St. Luke's Private Hospital in Metro Manila, you're going to pay a lot more. So if you're out in the outskirts of the city in one of these other hospitals, you're going to pay less. And if you want to go get the premium care, what the quote-unquote premium, that's your decision to make at St. Luke's and Metro Manila, just beware that you're going to pay more at that hospital. Let's keep moving. Number 6, be early and prepare to wait. What do you mean, Matthew? If I've got an appointment with the doctor at 10 o'clock, don't I just show up at 9:45 and stroll right in? Absolutely not. That's not the way it works here. And if you think that's the way it's going to work, you're going to be very disappointed. My wife normally has a doctor's appointment at 10 o'clock if we're going to St. Luke's, or at 9 o'clock if we're at Asian Hospital. But for this example, I'm going to use me. Last Wednesday, I was supposed to have a doctor's appointment at 10 o'clock in the morning. I had made this appointment 2 months ago. I got to the doctor's office. They said, no slots left available. There's 4 people ahead of you. And I'm like, well, what all do you mean? I said, Matthew made his appointment 2 months ago. And you mean to tell me I can't even get in? That's exactly what they said. Now, what did I say about getting there early and waiting? Well, whenever my wife and I went to the hospital recently, went to the clinics are normally in a hospital. Her appointment's at 10 o'clock. We get there at 9 o'clock, wait until 11, because there'll be 5, 8, 9 people ahead of us. The doctor gets those people out, but get there early and be prepared to wait, because in the Philippines, it just doesn't work the way you're used to in America. Number 7, there's an app. There's an app for everything, but there's an app called Now Serving. There's also a like button and a subscribe down below, so if you'd click on that, I'd really appreciate it. There's an app It's called Now Serving. Get that app and download it whenever you come here. That app will, A, it'll help you find a doctor. B, you can use that app to have online medical visits with your doctor. C, you can use that app to pay your doctor. D, that doctor can use that app to send you your prescriptions. And what else will it do? It does a lot of things. The Now Serving app is probably the most handy thing, the single most useful item that you can have for your healthcare here in the Philippines, other than money, is the Now Serving app. Now Serving. And I'll have that down here typed out on the screen below so you'll know exactly what it is. All right, let's keep cracking. Number 8. If you don't have health insurance, the out-of-pocket expenses in the Philippines are way less than they are in the United States of America. Here shortly, I'm going to go through a medical bill with you at the end of the video and give you some exact numbers. But if you don't have health insurance, let me give you an example. I went to the doctor the other day. I haven't set up my health insurance yet here in the Philippines, so I went to the doctor. Well, Matthew, how much did you pay? I went to see a specialist, and I only paid that specialist, and I think I paid a little much. My wife says she thinks we're paying her too much. But I go see her for an hour visit where she writes me a prescription. I see that doctor, and she only charges me 2,000 pesos. That's about 38 United States dollars to see the doctor, and that's it. She writes me a prescription. I do have to pay for my medications out of pocket, but a 30-day supply of medication cost me around $20 on top of that, maybe just a touch more. So the out-of-pocket expenses, now this doesn't cover forever. That doesn't mean everybody's expenses are going to be less. This is just our experience here in the Philippines. But as a general rule, if you don't have health insurance and you're paying cash to see the doctor, though you may have to wait a bit when you go, the cost to go see him is going to be less, and you got to pay for your medicine out of pocket. And the medicines, they're really just not too terribly expensive. Number 9, we're over halfway through. This one, do your research on it, because I don't want anybody beating me up in the comments. If you do have health insurance, most services and procedures here in the Philippines are going to be completely covered, even surgeries, but there is going to be a cap, and that cap is going to be lower than in the USA. What do you mean, Matthew? Well, in the United States, if you've got a health insurance plan, a lot of times that plan will have a cap per year, or sometimes for the life of the policy, that's $1 million or $2 million. Well, in the Philippines, it's probably not going to be that much. It could be somewhere in the 250,000, 300,000 peso range, and then you're capped out. Well, Matthew, what would a procedure cost? Well, for example, there's a procedure that somebody might commonly have to have here. We've recently done some research into. If you go to St. Luke's to have it done, it costs 500,000 Philippine pesos. If you go to Asian hospital, it would probably be about half of that. So if you have to have a major healthcare event in your life, most likely it would wipe out your health insurance completely at that point in time. And anything over and above that, you're going to have to pay for. Again, these are our own personal experiences. This is based on our own personal experience in the past. Do your research before you come so that you don't get disappointed. We're just here to help. Let's keep clicking. Number 10, hospitals here, well, they're state of the art. My wife and I are both scuba divers, and whenever I came here, people were saying, my goodness, I hope you never get a case of the bends, because there can't be a bariatric chamber anywhere close. I did my research just the other day, and there's about 10 of them in Metro Manila. They have very good bariatric care centers here in the Philippines. Now, why do I bring that up? We recently had an emergency room visit. I'm going to get into that before this video is over. When we went there, they had every piece of medical equipment that a human being could need. The same as you would have in the United States. Everything that you would have in America, they have here. But again, you have different levels of care. St. Luke's, state of the art. Everything there is going to be brand new, but it's going to get the job done, just like at Asian Hospital. But I was there recently. Everything there was new too. So the hospitals here, they're the same. They have parking garages, they have elevators, they have MRI machines, CAT scans, and they have needles. It has everything you need to get your health care taken care of. And here, it's state of the art. And by the way, people here are a whole lot nicer in the hospitals too. Just throw that in for free. Number 11. In the Philippines, I believe, this is my opinion, emergency care is better, depending on location, because we've only had one emergency. The emergency care was absolutely incredible. My wife had an emergency recently. It was a nightmare for me, but we were able to get it taken care of. I got her right into the hospital, and believe it or not, unlike in America where you have to go through this crazy triage situation to see if you're okay, if you're going to die, they know that. I mean, I understand triage, but no, I don't. I'm not in the medical profession. But anyway, I will tell you what happened here. We went to the emergency room. I told them what was going on with my wife. They put her in a wheelchair. They took her into the emergency room, and within 15 minutes, she was being treated for the ailment that she had. I can't remember a single time, except for one, where it was a fairly serious incident where we got treated that quickly. In America, it just takes longer to get brought into the emergency room. I don't know why. I'm sure somebody's going to comment below and let me know. But here in the Philippines, it just seems like the emergency care is better. We had more doctors that were attending to her needs. Everything happened more quickly. It was just a better experience overall. And they got her out quickly. Now, I will say, we had about the same amount of wait time in the emergency room as you would in America to leave. It took us about 8 hours once she was treated to get out. But the important thing is once she got into that emergency room, she got treated, and the care was amazing. So I would give it a 10 out of 10 for emergency room care in the Philippines. Number 12. This is the one a lot of you have probably been waiting for. How much does it cost? Give us some hard numbers, Matthew. Well, my wife recently, as I said, had an emergency. We went to the emergency room, got everything taken care of. She was doing better. So nighttime came. In the Philippines, you can't leave the hospital until you pay your bill. It's not like in America where you wait to get a piece of paper in the mail later. You don't leave the hospital until you've paid your bill. They just won't let you leave the place. Pardon me for the dogs barking outside. This is the Philippines. They won't let you leave the hospital until you've paid your bill. Well, how much did you pay? They got my wife all wrapped up, got everything taken care of. And my goodness, those dogs are loud outside. But anyway, they got my wife fixed up. They got her all bandaged, put back together. And she said, honey, go outside and pay the bill. So they came in the room. They brought me a bill. I looked at it. I went outside. They have a cashier. I went to the cashier and I handed him a credit card. He took the credit card, paid it. How much did it cost, Matthew? My wife's emergency care, an 8-hour stay with all, I'm going to go through this bill here in a second, $189 US. That's right. It was just over 10,000 Philippine pesos. It would be a lot more than that in the United States of America, I'm here to tell you. And I'm going to go through what she had done here in just a minute. But my wife's emergency care here in the Philippines, less than 2 weeks ago, $189 US. And that was at St. Luke's, the best hospital in the Philippines. We're getting close to the end. Number 13. How much do meds cost? What do medications cost here in the Philippines? Well, my medications for a 30-day supply, to round it off, cost $40. You say, well, Matthew, that sounds expensive. In America, I only pay $2 copay for my expensive. That's right, that's a copay. If you think about all the other expenses that come out of your paycheck or that this and that added up, that's how much cash I paid for the actual medication. There were no plans paying into anything to bring those prices down. So that was a cash cost. And that was for a fairly expensive medication. And one in the United States, if I had to pay cash for it, would cost a lot more than that. It would be over $100. Here I only paid $40 for it. And so it was very affordable. And my wife's medication, it's very affordable too. We haven't paid more than $30 for any one medication of hers that she's had to take. So here in the Philippines, I would say that medication is very affordable. This is the last one, 14. We're at the end of the road. What does it cost? What's the bottom line, Matthew? Well, I said that my wife recently had to go for an emergency visit at the ER, and that cost $189 US total, clear. At the end of the day, that's what it cost. No bills coming in the mail. Everything's over with. Well, in the United States of America last July, my wife had to go to the emergency room. She don't have to go to the ER all the time. We just pulled out some events from our life and trying to give you some information. But she had to go. This is what it cost in America, in Florida, at a very nice hospital. The pharmacy in the hospital, $227. IV therapy, $1,531. Laboratory work, $2,924. CAT scan, $12,783. Other imaging, whatever that means, $5,500. Emergency room general charges, $4,620. Pharmacy extension of some other kind of medication, $206. Total charges from the emergency room, $27,790.98. That is 1,528,500 Philippine pesos. That's a lot of cash. All right. The insurance company paid $12,099 and told the hospital that they could eat the other $12,895, which left me wanting to know what was the other $12,000 for if the insurance company was, if it was so easy for them not to pay it, how come it's so hard for us not to pay it? Anyway, at the end of the day, from a $27,790 emergency room visit, we still got stuck with a bill for a copay. We have health insurance, right? For $2,796.53. That is what it costs for me to take my wife for 10 hours to the emergency room to be treated in Florida, United States of America. We had the exact same work done here in the Philippines at St. Luke's, the most expensive, state-of-the-art, what some people say is the finest hospital on this island, and it was only $189 US. Now I'm here to tell you, that should speak volumes about the healthcare here in the Philippines. It was state-of-the-art, the doctors were kind, the nurses were fantastic. At the time we left, all we had to do was give them our money and walk out the door without bills coming in the mail every month like it is in America, where you pay and pay and pay and pay monthly premiums for health insurance and you still get stuck with bills. It's my opinion, it's my wife's opinion, that health coverage in the Philippines is a better value dollar for dollar than it is in America. But that's just our experience. All right, hang on guys. We're gonna close this dude out, and I got one more bonus for you while we do. Here's the bonus. Did you know that in the Philippines, whenever you go to the doctor, you don't call a female doctor a doctor. You call her doctora. You call the male doctors doctor. It's doctora and doctor. That's your bonus. The other bonus is please like and subscribe. We'd really appreciate it. Well, guys, we love you. We appreciate all of the likes and subscriptions and comments we've had over the last few weeks. We really appreciate everybody sharing the videos and taking time just to comment below. So if you have any questions, if you have any comments, leave them below. Make sure they're nice. I'd really appreciate that. But for myself, for my beautiful wife, we wanted to share this information with you because we hope it'll help somebody in the future. But for now, we're going to get out of here and take a nap, go to sleep. This is Matthew. That's Marielle. For Paradise Found, God bless. Ingat. See you later.